So first of all, I just want to say good morning to everyone, and I thank all of you for joining us for the symposium. Before I say anything further, I'd like to recognize the efforts of Paul Medeiros and Ryan Daly of NSF International for helping Midtown Detroit put together this jam-packed informational session today. For those of you who may not be fully aware, this meeting is meant to be a follow-up to all the work that our Detroit-based cultural center institutions took on together. It was a unique collaboration of 12 institutions that figured out how to operate with a new mindset while developing procedures focused on public safety, delivering on our missions both physically and digitally, while at the same time coordinating a district-wide reopening for the public. It was a lot of work, but we pulled it off, and here we are today to receive the most up-to-date research and thinking on COVID-19 with suggestions for how we move forward in this time of crisis. The timing of the symposium is not accidental. It was our intent to host this after the presidential election, when we thought we might have more clarity on what the new federal response could be for dealing with this pandemic, and having it right before Thanksgiving, a holiday that looks unfortunately like it will contribute further to the alarming increase of COVID cases happening both nationally and here in Michigan. We are at a critical moment in this pandemic where many of our hospital ICUs are at capacity yet again. Today is not meant to scare us, but to give us the best information currently available to make good decisions for ourselves personally and for all of our institutions. And so I'm glad that there are a number of other people who are able to join us, not necessarily based in Detroit's Cultural Center. So welcome to all of you as well. Let's pass it over to Paul to introduce Dr. Ruby Lee.
Thank you, Anne-Marie. Thank you, Ryan. Hello, everybody. Great to be here. Great to see so many familiar faces and so many new faces as well. So we're going to kick it off with Dr. Ruby Lee. I'm so excited to have Ruby kick us off. Her topic is scientific updates on COVID-19, hazard and control. So Dr. Ruby Lee, our senior microbiologist and senior food safety specialist at NSF International. Ruby has served as in this position at NSF International since 2011. I've had the great fortune of knowing her all that time as well and working very closely with Ruby. Ruby completed a Master's of Science in Microbiology and a PhD in Food Science and Technology, and was a postdoctoral scientist in animal science at Iowa State University. Dr. Lee is a much sought after speaker and an authority on various food safety and risk mitigation topics. She has supported numerous NSF clients with their COVID-19 programs, helping businesses to reopen and to stay open. So without further ado, Ruby, I pass it over to you.
Thank you, Paul, and good morning, everyone. Thanks for the opportunity to share a very important topic, scientific update on COVID-19 hazard and control. With only 15 minutes, I choose the hot topic, close contact, aerosol, silent spreader, Fomite contact, and more. Let's begin, shall we? In a cold day like that, let's warm up with a big question. What is the best way to celebrate Thanksgiving safely? You can stay home, or if you choose to visit a local cultural center or museum. The first question is, what's the risk level of visiting a local cultural center museum during pandemic with exponential growth of new cases reported every day in US? Please log in your answer in your heart. I hear you. You are right. The correct answer is medium. For COVID-19 risk assessment, there are 4 primary factors to consider: enclosed space, crowds, duration of interaction, and whether we have activity of forceful exhalation. On the right middle corner, you see visiting a museum cultural center is categorized as medium risk based on being indoor and potential close contact. Museums have implemented many controls to reduce COVID-19 risk factor, including indoor and potential close contact, such as COVID-19 control check by NSF, On November 17, the second survey of 850 museums published in the National Snapshot of COVID-19 Impact on U.S. Museum showed that museums are operating at 35% capacity on average to reduce potential close contact. Do you know that the definition of close contact has been updated on October 21st by CDC? Now, the old definition was less than 6 feet contact for a continuous 15 minutes altogether in one shot. But then CDC updated the definition to less than 6 feet for 15-minute contact that could include short, multiple, cumulative contact within 24 hours, 2 days before illness onset by pre-symptomatic carriers, or 2 days prior to test specimen collection from asymptomatic carrier until the time the patient is being isolated. All this update definition is based on lesson learned from super spreading outbreak. The most recent one comes from the 20-year-old Vermont correctional officer who wore a mask and goggle. However, he had multiple short, brief encounters with 6 pre-symptomatic carriers who are transfer prisoners in cell, doorway, or recreational room without masks for a total of 17 minutes during the 8-hour shift. CDC highlights the importance that everyone must wear masks in public. Universal masking protects everyone in public. Please don't choose masks with exhalation valve or vent because it may release unfiltered respiratory droplet. Please choose masks, preferably with 3 layers as source control to protect others by blocking respiratory droplet. You're welcome to watch NSF International webinar that was first broadcast in June, entitled Reopening Your Business and the Use of Face Masks. During that 1-hour webinar, you will learn the DIY mask material for optimal filtration to block the respiratory droplet that potentially with the viron, and also breathability that prevent you from suffocation. The second hot topic I want to talk about is aerosol. We all know that before July, the transmission mode covered mainly larger respiratory droplet bigger than 5 micron within 6 feet close contact and direct contact with COVID-19 carrier and indirect contact, Fomite contact of contaminated surface that has been contaminated with respiratory droplet.
No, I'm always busy with tons of other stuff.
The third mode is aerosol less than 5 micron in medical aerosol generating procedures such as intubation. However, before July, the big question is, could COVID-19 be transmitted by aerosol suspended in the air more than 6 feet in a non-medical environment? July 9, WHO published the scientific briefing. Those are from lesson learned from some outbreak report related to non-medical environments such as choir practice, restaurant, nightclub, fitness class, etc. In that scientific briefing, we clearly know that indoor, crowded, inadequately ventilated space over a prolonged period of time with infected person increase the risk of COVID-19 exposure. At the conclusion, short-range aerosol transmission cannot be ruled out. October, CDC published scientific brief, and it clearly stated that, yes, the most transmission mode of COVID-19 is through larger respiratory droplet of more than 5 micron within 6 feet of close contact. Yes, direct contact should be avoided. Yes, indirect Fomite contact should be avoided. Aerosol less than 5 micron in medical aerosol generation procedure, can generate aerosol. The big question is, can aerosol be generated in non-medical environment and promote COVID-19 transmission? The conclusion is there's no efficient rapid spread of aerosol with the viron, long distance and time. However, aerosol can be generated under special circumstances. What are some of the important factors that increase aerosol exposure risk? Number one, incubation time. Symptoms onset of COVID-19 patients with the highest viral shedding. Number two, if you are short distance with them. Number three, if you expose yourself long time with them. Number four, if you are in an environment with high density of people. Number five, if there's little ventilation dilution, such as you're indoor with poor ventilation environment. Last but not least, if you are involved in activity that generate aerosol, for example, cough, sing, shout, and talk. Do you know that aerosol generated from normal talking can consist of up to 3,000 1-micron particle per minute? And there could be 250 viron per particle. A simple math gives us 750,000 viron per minute. Currently, we don't know the infectious dose of SARS-CoV-2 causing COVID-19. However, we're asking the question, could it be similar to SARS that we first seen in 2003, where the infectious dose is only 300 viron in certain situation? How do we control aerosol? We may be able to learn from the Guangzhou restaurant outbreak in China. It showed that aerosol transmission of SARS-CoV-2 due to poor ventilation may explain the community spread of COVID-19. How poor? The poor ventilation rate in the restaurant showed that it's around 1 liter of air per second per person. According to NC standard 62.1, ventilation of acceptable indoor air quality, the minimum outdoor air in the restaurant should be more than 5.1 liter per second per person. So in a Guangzhou outbreak situation, we realized the indoor air is at least 5 times less than the minimal in requirement. What about museum? Museum's minimum outdoor air requirement is more than 4.6 for adult, 5.3 for children. Those are liter per second per person. And those numbers are pretty similar to a restaurant situation. Now, after talking about ventilation dilution, there's a very important publication come out that compare risk reduction and the cost using filtration and ventilation. And this study is called the HVAC, Filtration for Controlling Infectious Airborne Disease Transmission in Indoor Environment. The conclusion of this study showed that for reduction of infectious airborne disease in indoor environment, it appears that HVAC filtration of using a Merck 13 to 16 filter appears to be more cost effective than only relying on outdoor air ventilation. So in conclusion, to control aerosol, the basic requirement is to have minimum outdoor air per S-rate 62.1 guidance. Museum is recommended to have more than 4.6 to 5.3 liter of outdoor air per second per person. Now, you can also have filtration using Merck 13 filter or equivalent for recirculate air. So we dilute the air, also we filter the air. If you have higher budget, you can consider supplemental control. For example, air cleaner with standalone HEPA filter that you've seen in dental office, or UVC light, or other effective safe technology, or increased outdoor air. Where should we use it in the museum situation or cultural center situation? For example, if you have 4D theater with activity that promotes forceful exhalation, that people are so excited, they shout, they sing, they scream, that may promote aerosol, that may penetrate the face mask if they are not 3 layers or proper filter. So those are the situations you consider. The third hot topic I would like to talk about is silent spreader. On September 10, CDC published the current best estimate about viral transmission of COVID-19 from silent spreader. Who are they? They are asymptomatic carrier that never experience any symptom, and presymptomatic carrier that do experience symptoms later on in the US. Now, transmission from asymptomatic carrier are about 40%. During presymptomatic, they are 50%. Viral shedding from asymptomatic versus symptomatic are about 75%. So we cannot underestimate all these silent spreader contribute to COVID-19 transmission. How do we control all these silent spreader? We need to identify and isolate them as soon as possible by rapid testing. Currently, we do have a lot of rapid tests involved in home swabbing, but then we have to mail it out for lab testing. On November 17, FDA authorized the first COVID-19 test for self-testing at home for prescription use. It is the Lucira COVID-19 all-in-one test kit. The beauty of this test kit is rapid, simple, accurate, and affordable. How rapid? Within 30 minutes, you get the result at home. How simple? It's a simple 4-step. You swab your nose with a proper method. You stir the nasal swab into a chemical vial, and then you put the vial into the test cartridge and start the automated lab reaction. And then at 30 minutes, you read the result, positive or negative, directly on the outside of the test cartridge. This test is accurate. 94% agreement, 100% agreement if we exclude the sample with very low level of virus that possibly not active infection. 98% negative agreement. Best of all, it is affordable of around or less than $50 US. It can be used at home, prescribed by your healthcare provider because you are a suspect COVID-19 patient. It can be used at point of care use at the doctor's office, hospital, ER. Prescribing healthcare provider, after receiving your result, need to report all test results to the public health authority for monitoring and tracking. The fourth hot topic I would like to talk about is the Fomite contact. People may say, well, Ruby, now we know the most probable transmission mode of COVID-19 is through respiratory droplet, direct contact. Is it a big deal to control Fomite contact? Yes. April 2020, Hong Kong scientists published an article to show that this virus can survive on surface from hours to days. For common material in a museum cultural center, such as wood, it can survive 2 days. What about stainless steel or plastic? Up to 7 days. Now, knowing that this infectious virus decreases over time. Also, this study was conducted for 30-minute contact, so it may not reflect casual contact of a surface. But we learned from this study, the virus can survive on certain surface for up to 7 days. October 7th, there's another study conducted by Australian scientists. The conclusion of this study showed that viable virus was isolated for more than 28 days at room temperature and 50% relative humidity in the dark for non-porous surface. such as the common surface we can find in a museum, like glass, stainless steel. Now, this more than 28 days appears to be significantly longer time period than the 7 days we see in the Hong Kong study. The good news is the virus only survived for 1 day at 40 degrees Celsius in the dark. How do we control Fomite contact? Well, we need to continue to follow WHO, CDC, EPA guidance for cleaning and disinfecting surfaces that potentially may be contaminated by respiratory droplet of presymptomatic, asymptomatic, or symptomatic carriers. Now, this short presentation, we just cover scientific update on 4th topic, close contact, aerosol, silent spreader, Fomite contact. What more do you want to talk about, Ruby? I want to talk about long-term effect. November 13, CDC update long-term effects of COVID-19 after recovery. It is a long list. Most common long-term effects such as fatigue after people recover. What about the common long-term effects such as brain fog that people cannot concentrate in thinking? I have friends in Iowa that suffer from that. It is very heartbreaking. If you look at the less common list, this is horrible. It is systemic long-term damage. These viruses do not only damage our lung function, but our heart, our kidney, our skin, our brain, also our emotion. Ruby, so far, it is so depressing of what you talk about. Can you talk about something make me happy? I try. In November, there are some good news. As you hear from the news, FDA, emergency use authorization of drugs, Eli Lilly, and also Regeneron. You hear about President Trump used the one of the therapy being the Regeneron that recovers so quickly. These two drugs are monoclonal antibody mixed synthetically that can bind to spike protein of the virus to prevent the virus attachment and prevent human cell entry, to treat mild to moderate outpatients at high risk for progressing to severe COVID-19. Also, November 19, Eli Lilly granted the EUA for certain drugs to be treated hospitalized patients that need oxygen. Another good news that we hear from the news is about Pfizer and BioNTech vaccine that achieved 95% efficacy, Moderna 94.5% efficiency, and also recently we hear another company, the AstraZeneca, who achieved 90% efficacy. They're all seeking FDA emergency use authorization for all these investigational unapproved drugs. What are they? Now, for the first two, Pfizer and Moderna, they are messenger RNA vaccine. Once the messenger RNA being injected as vaccine to a human body, it will serve as a template to make the spike protein, which is harmless, to stimulate human body to build immunity. For FDA, the threshold to approve vaccine is 50% efficacy. Imagine we have about 70% people vaccinated. We may still not achieve the herd immunity to break the chain of transmission. With such a high efficacy of these two drugs at 95% efficacy, if we assume we have 70% of the whole population willing to vaccinate, we have big hope that the basic reproduction number will drop below 1.0 to achieve the herd immunity sometime next year. Even though we have the drugs, even though we have the vaccine next year, we cannot forget about the basic multiple hurdles, from monitoring health all the way to clean and disinfect. Together, we can help to break the chain of transmission of COVID-19. And may you all enjoy a safe Thanksgiving week. I can be contacted at the following email if you need any support. Thank you very much.
Thank you so much, Ruby. I think that in the interest of time, if somebody has a burning question that they'd like to ask, please raise your hand and we can ask it. If not, to Ruby's point, you can email the questions in. That will be wonderful. Ruby, thank you so much. You explained some of the key scientific updates so well that help us understand some of the rules that are designed to, based on science to keep us safe. The one parting thing that I'll say before I pass it back on to Anne-Marie is your point about the vaccines. I think that we've heard some very knowledgeable people say that ultimately it is not the vaccine that saves lives, it's vaccination that saves lives. So we got to get those, that 70% mark hit for sure. So thank you once again, Ruby. That was terrific. Anne-Marie, back to you.
Anne-Marie.
Thank you. Yes.
Hi, I may have missed this early on in the presentation. Will we get copies of the slides? Yes, okay.
Yeah, we will provide copies of the slides, and we're also going to post videos of all of the presentations, both on the CCPI website, which we'll email a link out to, and then NSF will also have it on their website as well.
Terrific, thank you.
Yeah, no problem, Neil. I am happy to now introduce Sean Egan, who is the Deputy Director of Labor for the state of Michigan. Sean brings a total wealth of experience across all areas of the economy with his background in the Navy, as an electrician and a lawyer. And his focus at labor economic opportunity is primarily on overseeing MIOSHA, workers' disability, and the compensation agency, the Bureau of Employment Relations, and the Wage and Hour Division. He also supports LEO's efforts across the spectrum as his experience spans many of the goals. And he's also been our contact there for working on COVID efforts for the state of Michigan. So I'm going to pass it over to Sean. Sean, do you want to share your screen, or would you like Ryan to pull up your presentation for you?
I will share my screen in just a moment, Anne-Marie. I did make a couple of updates on the slides that I did send over, which I will share with you so everybody can have them. Just want to thank Paul and Anne-Marie for having me on today. It's great to follow up Dr. Lee. I think it'll really help you understand what these rules are designed to do. So we're going to focus a little bit today on the rules. I will touch on DHHS a little bit, but as you know, that is a separate department. So certainly there are considerations there that we would not necessarily try to navigate. Really our goal in the Michigan Department of Labor is to get open and stay open, and containing COVID is the key to doing that. So we're really working hard to put in reasonable rules, make sure that we do a lot of education and outreach with which Paul and NSF are helping with, that I'll share a little bit about. I'm going to talk really fast. We have some slides with way too many words on them that I will talk through as we're trying to all keep up with the requirements that we're trying to navigate in our workplaces to keep our employees safe, as well as our customers and our communities. As Ruby shared, I won't spend too much time on this, but just reiterating, from the outset of this crisis, there have been three relatively static concepts that we've been working through, and that is the need for social distance, face coverings, and good hygiene. As Ruby mentioned, there's a lot of spread from asymptomatic carriers, believed to be around 40%. So these are folks that are going to get through your daily health screenings. They're going to be shedding the virus. They're going to feel fine, and they're going to be out going about their business, which is why it's so critical that we just maintain those distance, mask, hygiene, because that virus is going to be out there. And when we're both wearing the face coverings, we believe that we can cut transmission by as much as 70%. And it's just huge that we continue to do that. Now in Michigan, we're tracking workplace outbreaks. You can find this information every week at michigan.gov coronavirus. It's under the cumulative data tab. And just for reference here, I take out all those places that we might have a lot of non-employees, so we can really see where we believe employees are having outbreaks in workplaces. So I don't include schools and colleges, childcare, nursing homes, a lot of big numbers in those places. Certainly employees are getting sick, but really focusing in on just to show the scale of what's happening out there. Right now, DHHS is tracking 267 ongoing outbreaks. About 93 of those are associated with manufacturing or construction, 40 are in office environments. 105 new outbreaks reported the week prior to the 23rd. 15 of those are in office settings, 43 manufacturing or construction. The retail number was actually lower that week than it was the week before. So we're just continuing to see these outbreaks across Michigan. And just for reference, about 10 were reported in that week for social gatherings. Now, that doesn't mean that workplaces per se are a challenge, but as Ruby mentioned, congregation is bad, separation is good. So anywhere that we're bringing people from different households together, we're going to see these types of challenges. And seeing these numbers also tells me that employers are doing what they're supposed to do. They're notifying local public health. They're making sure that that contact tracing is taking place, and that's good. Now, an outbreak is, by DHHS standards, is 2 or more cases linked to a place and time. So this is not just a person coming into those settings that was sick, but 2 people that can be connected in that setting because of that contact likely have gotten the virus in that location. And as you know, everybody knows, the news in Michigan across the country is challenging for COVID. Our case numbers are extremely high. Our positivity rate was at 13.7% when I checked today. That means essentially it's everywhere. And what you need to be thinking about is that if it hasn't already, if you have people coming into work, COVID is coming into your workplace. And you need to be prepared on how you're going to manage that, as well as try to mitigate the risk of transmission. Now, over the summer, I know that a lot of you got quite familiar with the emergency orders that were issued by the governor after the Michigan Supreme Court ruling. We moved to different concepts. So on October 14th, MIOSHA issued emergency rules. That does cover museums, retail, you name it. Almost every employer in Michigan is covered by the MIOSHA statute. There are some limitations, but I'm sure that nobody on the call meets one of those limitations. So you are covered. One of the things we tried to do here was make sure we had consistency between what you were doing to what's expected of you now, as well as taking out a few things that might not have made sense or we didn't want to carry for several months. When we issue emergency rules, we expect these to be static for about the next 6 months. So the way I suggest to everybody that they really start to get in the game here and understand this is get those emergency rules, understand what it is you need to do, have those preparedness and response plans, and then layer in the DHHS epidemic orders that might come out. DHHS, we expect to be a little more variable as COVID changes, as our numbers go up and down. You're dealing with that now with those capacity limits at 30%. So those things are going to be things that you will layer in, but we expect these workplace rules to remain relatively static. So you should have a good opportunity to really hone in on those and make sure that they fit. We've also launched a few state emphasis programs. These are programs that are proactive enforcement strategies from MIOSHA. We're going to highlight this time offices, manufacturing, and construction, and that could include some of your operations. We did hospitals, retail, bars, and restaurants over the summer. What these are designed to do is recognizing those outbreaks and different types of complaints that we've been continuing to receive in all of these sectors. Our inspectors are going to randomly select workplaces in those categories and just stop in. They'll announce themselves to management and they'll do an inspection on the spot. And I can assure you that these are not intended to be gotchas. They're going to work with you to identify things that you could fix, maybe change. If you're not doing some things, you may see citations come out of this. Some of the must-haves you absolutely have to have. When they show up, they're going to ask you for your preparedness and response plan. Now, I know, talking with Anne Marie and Paul, that you are working with NSF. Many of you are working collaboratively from the outset of this virus to make sure that you had those things in place, and I applaud you for those efforts. It's critical that we all take this to the extreme on things that we might be able to do. But so I know that the vast majority of you are going to have those plans. If you don't, MIOSHA has created a template on our COVID workplace safety website for low and medium risk work environments, and that's the vast majority of employers in Michigan. You need to designate that COVID coordinator. It does not need to be a manager. This is just somebody on the ground that's going to be your boots on the ground to make sure that these COVID protocols are being put into practice. Now, you can have more than one. If you have different parts of your building, you have an office, you have the floor, you have whatever it is you're doing, you can have more than one COVID coordinator. You have to be conducting those daily health screenings, which must include a questionnaire. And you can use the My Symptoms app that was created by DHHS and U of M to do that for you. It's an electronic tool. You sign up as an employer, it's free. You'll get an employer code that you give to your employees, then they can use their smartphone, tablet, desktop, you name it, to answer those questions. It'll let them know if they've flagged for symptoms. employers have a real-time dashboard to keep checking, and it'll take care of the record-keeping requirements required by the rules in MIOSHA. Need to be conducting that training of your employees, including how COVID spreads, mitigation strategies, how to comply with your plans and policies. And I'm going to touch on the remote work policy because we've gotten a lot of questions on that over the last few weeks, of course. Now, within our MIOSHA rules, we do have some face covering requirements, and this includes employers providing those non-medical grade face coverings, requiring employees to wear them when they cannot maintain 6 feet of separation, considering face shields if they work in close quarters within 3 feet of separation. That's in addition to the face covering itself to help further mitigate the chance of spread, and then always requiring employees to wear those when they're in shared spaces. And that's going to be in-person meeting, restrooms, hallways, you name it. Now, I know that museums were lumped in with retail, and DHHS's order does have additional face covering requirements where employees are more than likely going to be wearing those all the time, as well as customers. And within our rules, we do have industry-specific requirements, which does include museums, libraries, and retail. One of the bullet points I want to point out here is that within our rules, which I mentioned we expect to be static for the next several months, you must require patrons to wear those face coverings unless they cannot medically tolerate it. Now, we do not expect you to have an employee standing at the door pushing people out of the museum, but we do expect you to make a good faith effort. You're going to have those signs that say don't come in, face covering required, etc. The goal here, as Ruby went over in great detail in her presentation, is to really break that chain of transmission, cut down the probability of spread, make sure your employees are protected to the maximum that they can be when we're trying to battle this virus, and just making sure you're doing those things. More than likely you have these things in place, but just wanted to highlight that for you. I know that in many of your operations, you're going to have certain areas where the general public might be coming in. You're going to have areas where the general public is not coming in, which might be more of an office type environment. We do include in the rule that employers must create a policy prohibiting in-person work for employees to the extent that their work activities can feasibly be completed remotely. So we've gotten a lot of questions on that, as you can imagine, but the goal here is congregation is bad, separation is good. So if you have activities in your office type settings that don't necessarily require a physical presence, please get those people out of the workplace and include that in your policy. This does need to be a written policy. It can be integrated into your preparedness and response plan. It does not have to be a standalone document. And you have to include the classifications and positions that must report for in-person work and why, and the reasons that they cannot be performed remotely. Well, a few of the questions I've got on this is about collaboration. That is not going to be something that can't be done remotely. What we're looking at there is we understand that some people will need to be present. You have mail coming in, you have certain database components that might not allow a VPN connection or some other tool to be used. We understand that, but you really need to analyze your workforce and have as many people out of there as you can do. And MIOSHA is going to look at that policy, and they're probably not going to dig too deep into the details if it's reasoned and thoughtful, but if it's just because I feel like they need to be here, that's not going to work. You're going to need to go deeper than that. I do want to spend a minute on quarantine and isolation. This is a critical tool, and we do get a lot of questions on what this means. The rule does require that you physically isolate employees with known or suspected COVID. Suspected includes those close contacts within 6 feet for 15 minutes or more. That's a cumulative 15 minutes over a 24-hour period. And the goal here is to mitigate the potential spread of COVID in our workplaces. So that includes keeping those folks out of the workplace, sending them out of the workplace if they get sick during the day. And then this C here is intended for those remote workers that I mentioned for the remote work policy. It is allowable for you to work with an employee that may have COVID or may have been exposed to COVID if they can work remotely and they feel confident that they can continue to meet their duties. That's fine, just as long as they're not in that congregating setting of the workplace itself. And then quarantine occurs when you have a close contact. You have not been confirmed with COVID, you don't have any symptoms, but you had that 6 feet for 15 minutes or more. That's a 14-day period from the last close contact. And it's written that way, recognizing that some people are caring for people in their home that have COVID, or maybe even outside their home that have COVID, known COVID, and they're going to have multiple close contacts over and over. So that 14 days can actually keep continuing to move and push out that possible return. And then we isolate people when they either have symptoms, they're confirmed with or without symptoms. And that's going to be a 10-day period from when those symptoms first appeared, or they got that confirmation, and then 24 hours with no fever, without medication, and other symptoms are improving. So it's really critical that you understand these pieces and that you apply them as quickly and practically as possible, so that, as Ruby mentioned, we can break that chain of transmission. Now, we have all of these materials available and more at our website at michigan.gov, COVID Workplace Safety. They've been up there since May. We have guidelines for every industry that's been named. For museums, I would look at the retail. Definitely check out for all industries. We have an updating FAQ on the emergency rules themselves based on questions we've received coming in. It's a great resource for you to get some of those questions answered. We have a wonderful hotline staffed by the MIOSHA folks at 855-SAFE-C19. They launched this in May. We get hundreds of calls. This is for employers and employees with any questions you may have about the rules or other things in your workplace. And if you need it, they will help get you over to the consultation team, which is a wonderful vehicle at MIOSHA. We've launched a few consultation programs. The Ambassador Program now, I haven't updated the slide yet, but now is in partnership with NSF to help us really ramp up the program. These are one-on-one pop-in consultations. This is not enforcement focused, where consultants will just stop in at various sort of open to the public type establishments, would be restaurants, bars, small retail, other locations where what we call heightened community transmission risk, where you have an open workplace setting that the general public may be coming into. The goal here is that many of these locations don't regularly interact with MIOSHA. So they might have some understanding of some workplace rules that they need to do, but they don't follow it closely like other large manufacturing or construction, where they more than likely have safety professionals on staff and those types of things. These folks can also request a consultation. It's a longer version. It's a wonderful tool. And all of the program material and toolkit are available on that same website. And then for those folks that may not fit into those categories, you can always request a consultation from MIOSHA's consultation team. And they can do that on site, over the phone, or otherwise. We're really pushing the over the phone the best that we can, only because there's a lot of demand. And we've launched the NSF partnership program just a few weeks ago, and that demand is quite high as well. So we're going to be working through that to really ensure that we're continuing to provide that educate before you regulate mantra that MIOSHA pushes out there, to provide the tools that employers need to keep it going and moving forward. We have great links on our website to the Pure Michigan Business Connect platform as a resource you can use to find PPE, non-medical grade face coverings, plastic barriers. The My Symptoms app that I mentioned, recently launched My COVID Alert, is a free app that will use cell technology to identify if you sign up when you've been within 6 feet of somebody that has COVID. So that's a great resource there too. And we're just really trying to continue and push our message, and our goal is to ensure that employers have what they need, people understand what they need to do. And as I mentioned, just really trying to get that distance, face coverings, and hygiene nailed down.
Do we have any questions for Sean Egan?
I was trying to get you back on schedule, Paul and Anne Marie, so I went really, really fast. I will share the slides so you can get them out as well.
Thank you. Any questions? Okay, well, it's looking pretty quiet out there.
I had a note in my head, Anne Marie, if I could be real quick. If you go, our Michigan Department of Labor YouTube page has all of the webinars that we've done. Speaking of that indoor air, we did a 4-part series with ASHRAE to talk about how the virus can spread, system things that might impact that. So definitely check that out if you're interested. Like Dr. Lee said, we see that as a potential mitigation strategy. General ventilation itself is not the panacea, but it can impact how things are happening in your workplace. So definitely, if you're interested, check that out.
Great. Thank you so much, Sean. What I'll say is if anyone has any follow-up questions that you think of throughout the rest of the symposium, we can get those to Sean and get a response back to you, but we'll share the slides and we'll share the video of this moving forward.
Anne-Marie, I
yep.
think we did have a hand up. I think Mike
Okay.
Bergman might have a question.
Thanks, Paul. It's Mike Bergman from College of Creative Studies. I had a question, Sean. When do you think, in your best guess for the vaccine, you think the early spring for the vaccine to be available to the public? And then are you going to talk about point of like pods, for example, point of distribution?
So most of the vaccine stuff, Mike, is going to fall with DHHS and probably won't be in our wheelhouse. I have gotten the question about how the rules might change. My advice to everybody is that what we're seeing, what we're hearing is that we have that glimmer of hope, but for the most of us in our workplaces, we're going to have to keep our head down and keep moving forward with these mitigation strategies for what I see as several months. And what I mean by that is I don't know how that'll unroll. Hopefully it'll be faster than what we're hearing, but I think we're looking at, June, July, August, later in the year by the time we get enough of us regular working folk. The medical people will be first, right? For us to really start to think about like the next steps beyond COVID for sure.
Okay, thanks, Sean. I appreciate it.
Yeah.
Any final questions? Okay, well, great. So if anyone has any further questions, oh, Ashley, do you have a question?
Yeah, hi, Sean. Thank you so much. This was really helpful. I was wondering if you could speak briefly about the flu, getting a flu vaccine, and whether or not the state is going to actually try to enforce that, or is it just an encouragement? I'm with Wayne State, and we've already gone through and basically told folks that they need to either get the vaccine or provide a waiver as to why they're not getting it. But I was just wondering if the state was actually going to come out with anything on that, or if that was just a institution or employer by employer item.
It'll largely be an employer by employer component. There's a few reasons for that. One is that, the state likely can't mandate you to get the flu shot, right? So certain employers will have to look at their operation, what that means. I can tell you, and I appreciate you doing that, Ashley. We know that the flu symptoms look a lot like COVID, so we're going to have that issue. We've been told, and we know that you don't want both for sure at the same time. There is some indication that just boosting your immune system with the flu vaccine can help you a little bit with some of the other illnesses that we have in the fall. But I think that that's a good way to look at it. And then certainly, as you know, you want to look at EEOC and some other ADA things on where you can and can't require those pieces.
Okay, well, thank you very much, Sean, for participating in our symposium. It was great to have you, and good luck with all of your efforts moving forward with dealing with this pandemic in Michigan.
Yeah, thanks for having me.
Great, thank you very much. Okay, so we are just a little bit behind schedule here, but I'm going to do a brief introduction of our next speaker. Elizabeth Merritt is the Vice President of Strategic Foresight and the founding director of the Center for the Future of Museums at the American Alliance of Museums. The Center for the Future of Museums is a think tank and research and development lab, and we'll post the link to that site in the chat here moving forward. But Elizabeth, take it away.
Thank you so much. Hey, Paul, I'm just going to ask your help making sure that I'm sharing my screen appropriately. So I'm going to hit share. How's that looking?
Oh, something's happening. We can see it.
Fabulous. Okay, then I'm going to start my timer. Well, as Anne-Marie said, I'm the Vice President for Strategic Foresight and founding director of the American Alliance of Museums Center for the Future of Museums. You may be familiar with my work through either the CFM blog or our forecasting reports. We write the annual Trends Watch report, our e-newsletter dispatches from the future of museums, or the research reports that we release throughout the year. We recently released one about the current state of museums during the COVID epidemic. Today's format is that I'm going to throw you 10 lightning topics, things that it might be worth thinking about as cultural organizations during and after the pandemic. I'm going to observe very briefly what's happening right now, and then I'm going to speculate about what this might create in the future. Emphasis, these are speculations, not predictions. These are what a friend of mine would call little brain grenades for you to walk away with to see if they provoke thinking later. So with that introduction, let's get started. Any of these could support a longer discussion, and I'd be happy to follow up with you about that. Number one, let's think about digital opportunities. During the pandemic, 98% of museums in the US closed, and we saw a huge pivot to digital. Everybody was on Facebook and Instagram and pumping out videos and doing digital escape rooms and giving tours behind the scenes and creating programming for school students, which is great. And in fact, we know from studies that 53% of the public participated in digital cultural activities during the pandemic. And better news, many of these are people who don't usually visit museums. So that leads to the thought, in the future, will museums learn to monetize digital activities, which is something they aren't very good at right now? This could be through dues and subscriptions, or through advertising revenue, or by cultivating donors who become fans of online content, or by converting digital users to actual in-place visitors. Okay, topic number two. K through 12 education. Any of you who are parents or otherwise helping with young people during the pandemic know how difficult this has been. And we have seen museums doing awesome work. Museums are sometimes opening up their closed exhibits as places to study and for schools to hold classes. Some museums are providing mentoring and supervision for students who need a quiet, secure place to study online, including high-speed internet access, which they might not have at home. Well, this is interesting. In the future, will we see more long-term integration of museums into formal education? Will this emergency work stick? Might we see more museum schools, either museums operating schools on their premises or schools regularly using museums as accessory classrooms? Might we even see public funding of museums as an essential part of the school system? Number three, supporting the vulnerable. During the pandemic, we've seen museums, again, doing fabulous work. Some are using their outside grounds and gardens to grow food and give it away. Some are making space available for food distribution or for COVID-19 testing. Some are helping some museums are helping people access services in the community, giving guides to where they can go for what kinds of testing or support. In the future, maybe this will lead to long-term partnerships with social services and nonprofit relief services. These are sort of ad hoc, wonderfully thrown together situations right now, but maybe it can be part of an existing, enduring infrastructure. So museums could be something that society looks to mobilize in emergencies like this. Number four, volunteers. During the pandemic, the American Association of Museum Volunteers reports that 84% of museums put their volunteers on lead, and 90% anticipate returning to open status with fewer volunteers. And when they're asked why, a third of museums cite age of volunteers as an issue, because of course, museums tend to attract older people as volunteers, and older individuals are more at risk for COVID. So some museums are using an increased use of digital platforms to stay in touch, either to give volunteers real digital work without having to come into the museum, or through staying engaged and providing support for them as individuals. So in the future, first of all, are those people going to come back? Or are we going to see fewer museum volunteers as museums reopen because the volunteers have found other opportunities? Will we see a change in demographics of museum volunteers? Are we going to see a greater preponderance of young people? And in which case, are they going to want different kinds of work? Or will they expect different kinds of support? And overall, are we going to provide more digital opportunities? Are museums going to say, wow, there were some really great things that museum volunteers were doing during the pandemic online. Let's keep recruiting them for that. Number 5, tourism. You are all experiencing the fact that we've had a nearly complete collapse of international interstate tourism, and a lot of museums have concentrated, when they can be open, on serving local audiences. In the future, are some museums going to have to wean their financial models away from tourism, or at least have a stable base they can pivot to when tourism is not in play, which happened after the 9/11 terrorist attacks. So this isn't a singular event. Some museums may have to learn to court repeat local attendance rather than just being the destination to go to when you're in town. And that might affect the types and schedules of exhibits they put on. They might want a more robust cycle of rotation so that there's always something new to get that local audience to come back. It also might lead museums to think of themselves more as social hangouts, not just in destinations for the visitor, but as places that are a regular part of the community. Number 6, higher education. During the pandemic, there have been drops in enrollment. Higher education colleges and universities are taking tremendous financial losses. They've already begun to make deep cuts to faculty and staff. And this is important for museums because there are over 2,700 academic museums and galleries in the US. I wonder if in the future we might see fewer academic museums as colleges and universities are trying to cut what might be considered to be amenities as they reduce their budgets. On the other hand, we might see more value placed on academic museums as colleges and universities want to justify the cost of an on-campus college experience. And in any case, there may be more pressure for academic museums to be financially independent of their university parents. Number 7, financial impact on museums. Hang on to your hats, this gets grim. According to the latest data from AAM that we just released, museums anticipate losing 35% of their operating income this year and 28% next year. Most museums tell us they have 6 months or less of operating reserves on hand, and 29% of directors are not confident their museums will be able to survive the pandemic. So in the future, are we going to see more museums partnering to share back-of-house services in order to reduce expenses? Are we going to see mergers and acquisitions as museums either try and find ways to survive in their mission and collections without having to operate as independent entities? Or maybe they'll go virtual. Maybe they'll say we can maintain our digital content and ditch the actual physical building and collections. Number 8, museum labor. During the pandemic, 53% of museums have furloughed or laid off staff as of October. And back in June, museums told us that they foresaw reopening with smaller staff. 41% said that. So in the future, first of all, as museums reopen and rebuild, is the mix of positions going to change? Are we going to see some recent positions that have received a lot of emphasis, like Director of Community Engagement or Vice President of Inclusion, maintain, while other positions, maybe front of house or education, that are being replaced by digital or streamlined functions, maybe those positions will be reduced? If we're going to be faced with higher unemployment in the museum field, could that drive wages even lower than they are now? And museums might try and make more use of flexible contract staff. And in response, we may see an acceleration of the already existing drive to unionize as museum staff try and maintain their working conditions and their pay. Number 9, orphan collections. Well, during the pandemic, as I said, there's a ton of economic stress. We see a potential for museums to close, and we're seeing downsizing of staff. So there might be more economic caution about what new collections to take on. I wonder if in the future, we're going to see a surge in orphaned collections in the US, important scientific, historic, or artistic collections that have been perforce abandoned by their institutions. In that case, we might see a need for a national clearinghouse to try and place those collections with suitable public nonprofit homes. And we might even see, this is a wish, a federal dowry endowment to send money with those collections to make sure that the institutions that adopt them are able to care for them appropriately. And last, number 10, grants and endowments. During the pandemic, we're already seeing some funders generously loosening restrictions on grant expenditures to help keep their grantees afloat. And we know that some museums have received permission from their boards to release board-restricted endowments. And you may have noticed the Association of Art Museum Directors temporarily suspended sanctions against museums that chose to use restricted funds for general operating expenses. So I wonder if in the future, first of all, among donors and funders, we might see a resurgence of general operating support, which was out of favor for a while, but is increasingly obvious is necessary for financial stability. We might see more pressure on donors to give unrestricted gifts that can be used as they need to be used in emergencies. And I wonder if in some restricted gifts, we're going to begin to see emergency clauses where museums basically get pre-approval in case of extreme financial and national pandemic distress to release those funds to ensure the organization's survival. There, that's 10 ideas in 10 minutes. And here's some information about how to stay in touch with me. But meanwhile, I think we can pivot to questions. And I will unshare my screen. There we go.
All right. Are there any questions for Elizabeth? Elizabeth, are you seeing any institutions out there nationally weathering this situation well? Who can we look at too, who might be doing a good job, whether how they're dealing with their programming, their operations, their financials?
Well, so there's good news and bad news. The good news is there are many institutions that at least so far are surviving extremely well. The bad news is in many cases that's because of their business plans and circumstances. So for example, one museum I've been talking to a lot is the San Diego Natural History Museum, which happens to have most of its income from research contracts that are maintained during the pandemic. So they've made the decision to close their doors for all of 2020, whether or not they're allowed to open locally. And they're doing fine. They haven't had any layoffs. On the other hand, there are museums that are doing all the right things. You know, they're trying to support their staff and offer benefits while they're doing layoffs and reach out to their audiences through digital engagement and try and develop new revenue streams. But that doesn't mean that they're necessarily doing well, even if they're doing everything right. These are really unprecedented times.
Are there any other questions out there for Elizabeth?
I have a question. This is Malika Pryor. I also have my toddler in the background, so sorry if you get a additional input. But I'm just curious from an education perspective. I've been thinking about museums for a long time as this space that is an accelerant in some ways for formal learning institutions. And I'm wondering if there are any museums that have had success maybe with a school district in this moment with sort of testing out what some of that might look like.
So for example, down in New Orleans, the Louisiana Children's Museum, which had already made the decision that it was going to be closed through the end of the year, reached out to a local charter school that serves mostly low-income children, majority Black, and said, look, you have to create social distancing in your classrooms and spread these kids out. Why don't you just take over the museum building and grounds? And your pre-K and your K students can use our museum as their school for the next 3 months. That's awesome. That's the most sort of large-scale partnership I've seen so far. But on a smaller level, I've seen a number of other museums creating partnerships either with learning groups that are organized by parents or with school districts to provide study space.
Thank you.
Hi, Elizabeth. I have a question. This is Leslie with the Wright Museum.
Hello.
Hi, great presentation.
Thank
I
you.
was just wondering, can you describe a little bit more about which museums are doing the gardens well?
Yeah, right. Okay, so let me think of a couple of examples. The Philbrook Museum of Art in Tulsa, Oklahoma. I believe, and I think that this is the case, they were not currently running a community garden, but they have plenty of grounds and they decided to create a community vegetable garden in order to raise food and give it away to local food distribution groups. There are some history museums, and I don't want to say which ones offhand because I may have the wrong ones in my head, but you can write to me later. that already had gardens that they ran as demonstrations in like historic sites, like this is our 17th century garden, this is our 18th century garden. And they said, ditch that, let's just grow food. So they took land already under cultivation and said, we can use our staff to raise that produce and give it away. And I think at least in the case of one museum I read about, it was like 9,000 pounds of produce. This is not minor.
I think even if it's like just one case that has nothing.
Christian, do you have a question?
Yes, Elizabeth, thank you for your presentation. I really appreciate it. I'm Christian Greer from the Michigan Science Center in Detroit. I really liked your insights. My question is about decision-making regarding missions.
Yeah.
Do you know how museums and museum leaders are handling that part of it with the social justice crisis as well as the pandemic and the programs changing? Do you think missions will change, and in what way do you think they will evolve?
Well, first of all, I want to say as a futurist, I never say what I think will happen. My job is to help people think of all the possible ways things could evolve and all the different things that could happen. I think there's a saying, never let a good crisis go to waste. This year has been so hard on everyone. The pandemic is uniformly terrible. The social justice movement hopefully is uplifting and progress in the long run, but it does make very difficult situations in the short run for institutions trying to figure out how they're going to respond appropriately. I'm hoping that both of those pressures are going to help museums think more broadly about their role in society. And whereas it might be that in the past a museum very narrowly thought about mission in terms of collections and exhibits, there may be more broad thinking in the future about playing a bigger social role in supporting the community through the lens of a museum's specialty and focus. But for example, you may know of Project Row Houses in Houston. So this is AAM considers it to be a museum. We have a broad definition. It's a set of historic row houses that were saved from development. And some of them are developed as artist studios. So in some ways it's an art museum, in some ways it is a historic site, but their commitment is to helping the local community, whatever that means. So they say art makes communities stronger, but they run a laundromat because the community doesn't have a laundromat. They run a daycare center for young women who are trying to complete their schooling because as single mothers, they need that kind of support. So that is thinking broadly, not just within the boundaries of this is what a traditional museum is, but here's our philosophy of seeing the world through the lens of art or science and history. What are all the things we can do to make our community a better, stronger place?
Wonderful, thank you.
Elizabeth, I have one final question. Finances are very tight for all of our museums and institutions here. And clearly digital work moving forward is going to be clearly balanced with what we do physically within our buildings. With money being tight, what should all of our institutions be thinking about digitally? You know, if you're going to invest in something moving forward, what should be the bare minimum that everyone should be doing right now?
Right. That bare minimum is going to be different for every institution. And I'm going to, before I answer briefly, I'm going to refer you to two resources. One is I just published a post last week on the Center for the Future of Museums blog about assessing certain critical digital tools during the pandemic. Things like, you know, what might you do to be able to do buy-ahead ticketing to control attendance and maximize income where possible? What are some things you can do to try and create safe experiences on site? So take a look at that post. In a broader strategic way, I just finished writing a chapter about that for the next Trends report, which will come out in January. So that will be the 2021 edition of Trends Watch. And I'm in sorting through this and talking to museum people about digital and digital strategies. I think the most important thing is to realize that museums have to integrate this digital thinking at the very top. It isn't like, should we add a team to create digital content? And should we task somebody with doing this one project? It's seeing digital as something that is essential to strategy, just the way that electricity is essential to running your building. And understanding all the possible things it can do, whether it's helping you communicate or helping you interact or helping you move people through the building or helping create compelling experiences, understanding what it can do, understanding how those individual things might help contribute to the museum's bottom line, and understanding the long-term costs to figure out if the museum can support that. And there isn't an easy answer because that's going to be different for every single organization.
And if we can just sneak in one more question from Larry Baranski at the Detroit Institute of Arts, has asked whether or not the AAM has documented any metrics about audience engagement with museums' virtual content.
We have not directly. The good news is that there is a wonderful study that came out that is done by LaPlaca Cohen and Slover Linnet research firm in Chicago. It's a special edition of their usual culture track report that looks at the American public and cultural institutions during the pandemic. And there is some wonderful data in there about what members, who among the public are using data from cultural institutions, including museums. That's the report I was citing when I had that one little line about there being good news, which is a lot of the people who are using museums' digital content are not people who are usual museum goers. So this is a huge window of opportunity to win new fans. Take a look at that report. It'll have some really good data for you.
Perfect, thank you. And we'll help share that out to everyone here. Elizabeth, thank you so much for participating in our symposium today. It was great having you.
It was my pleasure, and I hope people will follow up with me about points that they're interested in. I know that that was a fire hose of information.
I will never think of brain grenades in another way.
Okay, take care.
Thank you. Okay, Paul, I pass it over to you.
Great, thanks, Anne-Marie. I am very happy to be passing it back over now to Werner Linders, who's going to provide a COVID-19 global update from NSF's perspective. Werner Linders is our NSF Global Director of the NSF Checked by NSF program. Boy, how many times can I squeeze in the word NSF into my introduction? Werner has over 20 years experience in food safety, risk management, and brand protection consulting in the EMEA and Asia Pacific markets. Most recently, Werner was the global head of an international food safety consulting practice. He's also provided assistance to technology-minded startups in the food and beverage sector with solutions based on augmented reality, statistical, quality assurance, the Internet of Things, gamification, analytics, and so on. Werner is a member of the Global Markets Technical Committee with the GFSI, that's a Global Food Safety Initiative, and a department board member at the University of College Ghent Faculty of Biosciences. When Werner is not spending time with his large family, he's finishing his house renovation or teaching jiu-jitsu or preparing for his annual quarter triathlon. Very happy to have Werner here today. Take it away, Werner.
Thank you very much, Paul and Anne-Marie, for the invitation and the introduction. If everything is well, you can see my screen now.
Yes.
And I will kickstart and do a little attempt to make up for, I think you're running a couple of minutes behind time, but let me try and move straight to the next slide. As you've seen from the first slide, I'm based in Belgium, Antwerp. And normally I would start presenting our country with a few, I would say, nice things that we have. It's probably one of the smallest countries in Europe. If you have some beautiful cities that you may have seen on your trips to Europe, Bruges, Brussels, and Antwerp. We also center, as being in the center of Europe, we has the European Parliament and the European Commission. And when it comes to food, we have some wonderful Belgian chocolates on one hand, but also more than 1,000 different beers, which I think something to be proud of. What unfortunately doesn't make us too proud lately, and lately is unfortunately for the last 8 months, is this kind of statistics. Belgium has been featuring in the first wave of COVID, not only in Europe, but I'm afraid internationally on the top of the statistics when it comes to the density of infections, not only in the first wave, but also in the second wave. And also when it comes to the number of deaths, whatever statistic you look at it in total or in particular by population or by 100,000, we unfortunately feature twice on both on the first wave and on the second wave on the top. That raised with me the question, what is our government doing different than many other governments? Because you can imagine with this kind of statistics, things coming very close. If I look in my friends and families, many people know someone that either been hospitalized or has been very ill. Luckily, the majority of cases recover well, but it's getting very close, and that, of course, triggers as any scientist on what is happening, what is taking place in this country different than in other parts of the world. So when I got the invitation from Paul to give a global perspective on this, I thought this is a good opportunity to start over the last couple of weeks listing down where are we, let's say, what have the governments, what do they have in their toolbox to manage this crisis? And before we start with that, I want to show one more slide, lifting it up from Belgium to the EU. And as you can see, EU and US from a distance don't look too different when it comes, but what looks very different is Asia-Pacific countries. Please take note that the scale on these three graphs next to each other is the same one, and that of course triggered our attention, saying what are they, some of them more successful than others, what are they doing different compared to some other parts of the world. So before I go through the toolbox, I quickly want to still with Pratt and a comparison that I got from Thomas Pouye, who let's say introduces the concept of the hammer and the dance, where in any population, when you start to see infections taking place and you don't take any measures, the logic next step is that these infections spread very rapidly. Once it gets out of control, and we've seen this all in the first wave, the only thing to do is to use, the only opportunity to get back into control is to use the hammer, while the hammer is indeed full isolation, full quarantine, in order to get back to some level of normality. Once you reach that level of normality, which we noticed has been defined differently in different parts of the world, you can start, as it was mentioned by Thomas Pouye, start to dance. You have a whole list of opportunities as a government to use these different tools that you have in your toolbox in different ways. So what are these toolboxes, or these tools we have in our toolbox? I'd like to introduce the first layer, which is probably stating the obvious, but even there, many struggle with it, and I will give some examples of that later on. And by the way, I've been focusing the presentation or this discussion on governments, but at the end of the day, from listening to Ruby earlier on, or to some of the other speakers, you can apply this. I've taken the governmental approach, but you could do this at regional level, at country level, even at a local community, but also at industry level or at any type of institutional level. That the majority of the, let's say, the tools available to manage a pandemic are very similar, with that difference that indeed there are some expectations and rules that come from governments. So coming back to the first layer of let's say what you have to your access is what we call stop as many as possible of the infections coming in where possible. And that could be as straightforward as building wall around your community. And of course, if you live on an island, as Australia and New Zealand, it's potentially easier than if you are surrounded with long borders. But having walls around it, and then secondly, with checkpoints and with quarantines for those people who are, let's say, suspicious of potentially being contagious, is a first layer of defense. The second layer of defense is the famous bubbles. And you have an endless list of defining the bubbles. It could be limiting the size of the crowds, and I will give again some examples of how different governments have interpreted that in different ways. You could work with curfews, which and I think the majority of European countries certainly today have some level of curfew at the end of the evening, that we're not allowed to, unless for urgent measures, to leave the house until the morning after. You could work with appointments in businesses, so that rather than having an open door that people come on individual visits, you can ban certain types of gatherings. And the most famous example, but also the most expensive one of this second layer, is the total lockdown, the hammer effect as such. The third layer that governments have at their disposal is for those people that, while the second one was more minimizing the people they meet, the next one is when those who filter through and meet other people, how can we minimize the risk that they pass on certain the infection? Put differently, is how can we reduce the contagiousness? And there are again a variety, and the masks is potentially number one in this list. It took us a while in some parts of the world to get access to sufficient quantities, but luckily that's now better under control than it was half a year ago. But there are also, again, linking it with the previous step, gatherings where people sing or make a lot of noise are potentially to be prevented. Also, if you really have to meet people, yeah, where possible, meet outside. And if that's not an option, then ventilation, as mentioned by Dr. Lee, is certainly an area that requires attention. And create, where possible, a hostile environment for the virus. And with hostile environment, we know that lower temperatures and lower humidity are favorable for viral transmission. So if we put this high enough, and summer of course helps, but not in the northern hemisphere for the next couple of months, then that's certainly a requirement. The next level is what we call the test, trace, and isolate, which is a very crucial one. And in my opinion, if I focus on Europe for a second, it's certainly something which we can improve a lot, to say the least. Contact tracing, and I will give some examples of parts of the world who have been more successful with that in a minute. The apps, it took us in number of places a long time to have some kind of Corona alert app. From the research I've done in the last couple of weeks, I have to admit I could not find one single country that, with the exception of maybe some in Asia, but in, let's say, the Western world, I could not find good examples of where the apps did make a significant contribution in limiting the spread. There are also a vast list of early detection ones, and one that I find very interesting is the one of trained dogs, which you may have heard about, that give us 100% accuracy within 10 seconds. Personally, I think that might be potentially a very interesting rapid test at airports combined with some of the previous tools. And finally, is limit the mortality. That's an important one, of course, and part of that has taken place well in advance in the years ahead, that health system preparedness, the quantity and quality of critical care capacity, but of course also vaccines and therapy, as mentioned before. Fine, this is a whole list of, let's say, tools that governments have at their disposal, but obviously it doesn't come in isolation. Public health is a key factor, but it's finding the right balance between public health on one hand, economy, and I think that relation has been, that became clear, I think, as early as March, that putting in a quarantine or a lockdown comes at a very high cost. But I think an important third element is the individual freedom, and that's where you see very different way of dealing with that in different parts of the world, in particular when we compared East and the West to find the balance between these three components. Before we do our tour of the globe, I quickly wanted to share with you the check by NSF concept. And without going into detail, when COVID struck us in different parts of the world, and then I'm talking the period April, May, June, NSF bundled all the knowledge available across all our different divisions. And as a good corporate citizen, we've published a series of COVID-19 online trainings, pandemic response fundamentals, which we put free available online on our website. And in addition, for those organizations that wanted to go further, we put teams together in all parts of the world to support local businesses and communities to bring it to the next step and help them to set up proper COVID-19 plans in place and to implement them together with training and continuously improvement. We launched this in June, July, and probably one of the first countries that came back to us and said, this is really, thanks for offering it, but this is not really longer an issue in our part of the world, was China. And I have to admit, it took me by surprise when I was doing my weekly tour of the globe with all the different divisions. And China, from very early on, and I'm really talking about July, they say it has been a very bad problem on a huge level in the beginning of this year. But we have the feeling now that it's under control. And when we have certain issues, they get addressed at local level in a very, very strict way. And then when I started to analyze what China had done, comparing it to these 4 layers, I think they used all 4 of them, or at least the first 4 of the 5, in a very, very solid way, or all 5 almost. And not only in a very strict way, but also very early on. So that's something I learned from doing this analysis around the world, is that it's not only what measures you take, but when in the cycle you take these measures. And so in the case of China, they closed their borders, they ordered lockdowns, mandated masks all very early on, used test, trace, isolate programs, including electronic tracking, and they made mandatory forced isolations and quarantines, which is a clear differentiator of some other parts of the world, and with success, if we look at least from an economic perspective at the current level, then they certainly has won on that side. Going further around that part of the world, then there was a second group, which South Korea and Taiwan, which didn't need all of them. They relied very heavily on the fences, the strong fences, being it on a very local level, and at the same time, test, trace, isolate. What I found fascinating by looking at these countries is, first of all, they go quite a distance when it comes to tracking your phone to make sure that you stay home. And interesting, I would say, they also have huge fines for not being, let's say, if you get caught not respecting your quarantine. It's something that, at least in Europe, and I'm sure many of you can judge better the situation in North America, but in Europe, you get big fines if you, for instance, break a curfew, but not if you or caught not taking your quarantines. That often doesn't come together with any fines. The second thing I found interesting in some of these other Asian countries is that that I would call them a world-class isolation program. When you need to go in quarantine, when you need to get isolated, they use hotels and government facilities to isolate people and give them money, food, medicine to compensate them for the disadvantage of being 2 weeks away from their family and businesses. And that's something I haven't seen in many other parts of the world. Moving further on to New Zealand and Australia, very strong, let's say, measures on layer 1 and 2, very strong, and I will come back to that also on in one of the further slides. All the countries mentioned so far were all countries that did had the ambition to work towards zero prevalence, so that there were no cases, and if there would be, so that they used the hammer in a very strong way to go all the way back to zero prevalence, and then when through their good tracking system that they would encounter or find out some places where there was need to intervene, they would do this in a very controlled fashion. Japan has a slightly different, they never managed, to my knowledge, to go really back to zero. They always had like around 10 cases per 100,000. I know in the last couple of weeks it's increasing again, but overall over these last 8 months, they always had some cases. But I think what they've done in quite a fascinating way is taking tracing in a complete different way. They use the principle of backward tracing, which I haven't seen so far in other parts of the world. The tracing that I've seen in the majority of places is where you where a tracer contacts you when you are being in contact with a high risk or when you are positive, and you will try to identify who you have been in contact with. In the case of Japan, they put a lot less emphasis on who you contacted once you were, let's say, contagious, but much more important, they try to find the source, because the faster they find the source of where you got contaminated, it helps them to identify who else in the community potentially is at risk and needs to be isolated. That I found a very interesting observation of Japan. Moving to Europe, and I could steal the rest of the time today just talking of Europe, but I wanted to share two examples of, let's say, the European situation. One special case in Europe is Sweden. Sweden had, probably as only country in the whole of Europe, no lockdown measurements. They had only recommendations, nothing was mandatory. So even masks were not mandatory, and their idea was to go all the way for herd immunity by fall. Unfortunately, they failed. I think if we look at the statistics over the last couple of weeks, even to that extent that yesterday the local government stepped in and took over from the virologists and the epidemiologists who were leading, let's say, the whole pandemic so far, and introduced a rather strict lockdown. Last week, they had the first, let's say, containment of bubbles of up to the scale of 8. As of yesterday, that was reduced to 2. So I would say that they're very much into where we are as the rest of Europe today. I was going to talk as well a few words on Africa and Latin America, but for the benefit of time, I will move this to a next opportunity to share this with you, and would like, in conclusion, to add one additional dimension to this model that we described before. And that model, as I described before, was economy, public health, and individual freedom. Personally, I feel there is an important one that cannot be underestimated and that really concerns me. That's the secondary health effects. And you could argue it's part of public health, but I clearly wanted to mention this separately here. The reason that I give only two examples. One is let's say, a statement from the World Health Organization and UNICEF, who warned us in a couple of weeks ago and also in the middle of the year about the decline in the number of life-saving vaccinations around the world. And this is the first time, I think, in 28 years that they see a decline. And that obviously will come at a cost later in our lives. So that's something to be aware of. A second topic, and that was when I was talking to some of our colleagues in Australia a few weeks ago, where they were explaining me the difference between the strict measures taken in Victoria versus New South Wales, where in New South Wales allowed to have some level of let's say, having interaction, in particular for the youngsters with friends, etc. While Victoria was no excuse, everyone will stay home. They see already now at this point in time the impact on suicidal risk amongst the age group 15 to 25-year-old ones, and that even only a few weeks and months after they're coming out of this lockdown. By coincidence, I found at the end of last week this chart, and sorry that some of the words here are in Dutch. It's a research of a Belgian university who tested the mental well-being every 2 weeks in a group of about 20,000 participants, and by industry sector. And interesting enough, the elderly, who interestingly enough are at most risk, or having the best mental well-being compared to all the other sectors tested. That restaurants and hotels are pretty high, I think will everyone understand. But what's rather alarming is the students. Students again who, and on this graph, the lower the better, you see the uncertainty in March, April, then you see the summer period with school holidays, and now with the second wave that students need to be locked up again, really causes serious pressure on their well-being. And I think these are certainly areas next to the COVID-related public health to take into account the secondary health effects. To close off, I like to finish on a positive note. Some of the previous speakers have spoken about the vaccine, but not only the vaccine, I think also the treatments that were referred to, and as well as the overall management of the pandemic will allow us to very soon go back to some level of normality. And I like to show this picture to the right, which seems like it's ages ago, but this is only 5 kilometers away from where I live. It's one of the largest electronic dance music festivals in the world, and you see 400,000 visitors that come together from, I think if I'm not mistaken, 119 different countries. It's only 14 months ago, this picture, but it feels like it's a lot longer ago. And I'm sure with all the measures taken that this dance music festival soon will come back. And I thought it was an interesting one to close off with that, because the name of that dance music festival is called Tomorrowland. And I think when they started 15 years ago, they probably wouldn't have thought about the link, but I think at this point in time, it's certainly a very appropriate name. Thank you for the invitation, and I would like to give the word back to Paul.
Thank you so much, Werner. Now, when I look closely, oh, wait a second, there's an echo. Okay, Werner, might have to get you to mute your line for a second. Can everybody please mute? Oh, echo's gone. Good. Werner, when I look closely at that one music festival, I think I see you in the front row. Was that? I think that was you. If I look closely enough, that's excellent. Werner, you've given us so much to think about. Does anybody have a burning question for Werner? Because I know that time is tight. Okay, Werner, I can't resist. I have to ask you one question. Put you on the spot here. Given how governments have access to the toolbox, Why is it, do you think, that European governments did not learn the lessons of all the success enjoyed by how the toolbox was used in Asia?
I'm not going to answer that, or I will answer it in a very different way. There is no, one thing we learned is that even a lot less than what I've seen in the US, there has been no Europe when it comes to this pandemic. Europe has been completely absent, and when you ask this question to many European politicians, they say we were not mandated. Health policies is a national responsibility. So, but I think it's clearly a lesson, and I think it will change Europe because if we go back to March, April, European countries were fighting against each other to buy masks all over the world. So we were missing a strong Europe. So at this point in time, I think some European countries did learn a little bit from some Asian countries. But one big lesson is that as a European nation, that there is room for improvement.
Excellent. Thank you very much, Werner. That was terrific. I'd like to bring the panel members now together. I see we've got most everybody on. Patricia Walker.
Yes, I am here.
Okay, excellent. Okay, good. Just making sure. Thank you, Patricia. Excellent. So we are going to transition over to our panel conversation, managing pandemic fatigue, best practices in keeping employees and guests engaged and committed. Clearly, COVID-19 has not gone away. And as Sean showed and discussed as well, Sean Egan, infection rates are rising. Michigan, no exception. And the strain on everybody is quite unrelenting. So no wonder we're tired. No wonder pandemic fatigue can gain a foothold. And also, as Sean said, at 13.7% positivity rate in Michigan, it does indeed mean that there's a strong likelihood people with COVID-19 are entering your workplaces, entering your cultural institutions, entering your schools. So again, as Sean said, we've got to keep our head down and keep plugging away. But how do we do that as we're also getting exhausted? So that's what the panel is going to be discussing today. It's quite an undertaking, quite a task. So I will briefly introduce each of the panelists. Then each one will spend a few minutes just giving a brief overview, touching base on some of the key points as to how they're addressing employee or student or visitor engagement in their locations. After everyone's had a chance to speak, we'll regroup again, and it'll be a chance for the audience to ask questions of the panelists and generate some discussion. So we've got 4 distinguished yet grassroots panel members who I'm happy to have on. We've got John Anderson, Chief Operating Officer, Michigan Science Center. We've got Michael Brueggemann, Senior Director, Facilities, Event Operations, and Campus Safety for College for Creative Studies. Patricia Walker, Chief Administrative Officer, Michigan Opera Theater, and Marianne Wilkinson, Executive Director at the Scarab Club. Terrific. Welcome, panelists. We're going to kick it off with John Anderson. John, the floor is yours.
Thank you, Paul. Thanks for putting this whole affair together today. There's a lot to talk about here, and as I was sorting through the 30 minutes worth of topics, it occurred to me that really the place that I keep coming back to is that the way to keep our constituents, employees and guests, engaged is to do a good job of having gotten them engaged in the beginning. And that seems to be playing out, at least in our workplace. That seems to be playing out. Now, those of us who operate in a seasonal industry and who have lots of part-time employees are sort of familiar with this this disengagement, the July slump is a way to talk. You get everybody on board in April for your big summer season, and by July people are exhausted, and so you've got to have mechanisms built in there to re-engage. And we did a lot of pre-engagement. Of course, we worked with NSF International to put our pandemic processes in place and made sure we met all the requirements for the state and did all the training. Made sure that there were resources. But, you know, I'm reminded here at the Science Center, Aristotle has told us that nature abhors a vacuum, right? And although I guess scientists at Tulane are proving that nature doesn't actually abhor a vacuum, some vacuums are important for the universe. In our case, it's not so much the absence of information as the constant ebb and flow of information. So having oriented the team, put together a pandemic response plan that meets state requirements, right? We also felt it was important to provide a guide to our staff that translated all those requirements into what you do on a day-to-day basis. Here's the door you open. Here's the thing you do or don't do. Here's where you hang your coat. Here's where you eat your lunch. So we got some buy-in at the beginning. There wasn't a vacuum, but of course we went through all those changes. Don't wear a mask. Masks. Stay away from masks. Never touch a mask. Oh, for the love of God, put your mask on and never take it off. Right. And so what we've had to try and do is be one step ahead of that public communication by going to our employees and saying, hey, you're hearing conflicting things. Here's our decisive answer for you about what to do until the next time the information changes. And what that's developed into for us, particularly as we've implemented sort of the public-facing protocols, sanitation and disinfection, we've got a clean team where everyone in the building is decked out in a clean team, a reflective clean team vest. And we have every hour on the half hour, everyone drops what they're doing and we sanitize things. And a bunch of other there's a standard spiel that you get from the mask control officer outside the front door when he sanitizes your hands and reminds you how to put your mask up over your nose and mouth. Thank you very much. What's happened is we've developed a ritual, and I think really what's proving to work here is that by having this ritual, our employees are in a groove. Our members who come back are in a groove. That they know what to expect. They know things are going to change. They know there's uncertainty, but they also know that there's mechanisms in place by which they're going to get the information, guidance, and support they need. And so they're not left wondering or floundering. And as a result, we've been pretty successful in keeping folks' eyes on the prize. Now, I don't want to jinx us, but we have yet to have a confirmed exposure. We have yet to have an employee at the building who's been diagnosed. We've yet to have anyone with symptoms. We're pretty diligent with all of our measures, and so although I think you could say that disinfecting the buttons at a certain point becomes more pandemic theater than actually infection control. And right, we probably need to talk more about MERV-16 filtration and outside air exchange and enthalpy wheels. Having the ritual reinforces the sound practice and good intentions behind it, which to me it seems like it's the thing that is keeping us engaged.
You're on mute, Paul.
Thank you. Thank you very much, John. And at this point, I'm going to pass it over to Mike. And thank you, Ryan.
Thanks, Paul. Thanks, NSF and NDI for hosting this. This is great information. I think with us back in, sorry about that. Can you hear me?
Yeah, you're still there.
Back in March, we started with our crisis management team. First, we had a plan, and the plan started back in March, and then going through into the pandemic. I think getting people engaged really has a lot to do with communications and setting the tone. and starting off as the pandemic changed along the way, like John said, and do the pre-planning, get your plan in place, get everybody engaged, the CCS community, including the students. And we basically spent all summer getting the campus ready, providing communication to students, providing communication to employees. And we have about 1,400 students, and we have about 540 students that stay on campus, and the rest are commuters. So you can imagine with dorms and student housing, we had to take the density in mind. Then you had to have certain rooms put aside for quarantine or isolation rooms, and so all that went into the planning. We worked really close with the City of Detroit Health Department, which was really helpful. And then we spent, like I said, all summer putting together plans and getting our campus ready for density, plexiglass. We added extra shuttles, for example, to keep only 6 or 7 people on our shuttles because we have 2 campuses, and to get people back and forth from different campuses. We do that. About 170 rooms that we have. We've increased our cleaning staff, and so we, as we evolved through the summer, we had a lot of communication updates with employees, with faculty, and with students. And I think, like I said, communications, people understand what our expectations were, and through website, through Zoom meetings like this, we've educated. We had Zoom meetings with 200 people on, just talking about our plans, what they can expect when they get here, and then every time we readjusted them, taking time out to readjust our communication plans. Great leadership tone at the top since this thing started. We couldn't have did it without the leadership, and we did what we did right. And I remember planning this in the fall and saying, I want the campus to be just like your home, right? You feel safe at home, you're clean. And when you go to campus, I want our students and employees and the community to feel that safe. And we've got some great feedback on that. Communications, again, I can't say it enough. Through our website, we put a tracker on there. So I think the big keep people engaged so they know what's going on, so they can go on our website and see how many cases. I think the big problem with miscommunication or misinformation is if you have a case on site, people, you might have one person that's affected or one case that you're doing contact tracing on, and before you know it, rumor gets around that the whole campus has got it, and it's really not the case. So to getting people to get the right information, you only can tell them certain things to get that information contained. We did a lot with testing. We probably did over 3,500 tests on site. We went through 4 different labs. I'm really happy to report we only have like a 1% infection rate, which was great. We spent a lot of time on contact tracing. We brought on a health resource manager, did contact tracing for us. She did an excellent job working through our dean of students, and it's worked really well. And we're really fortunate to get where we're at. So, thanks.
Terrific. Thank you, Mike. Patricia.
Thanks very much. So Michigan Opera Theater, which owns the Detroit Opera House, contracted with NSF in June to develop a COVID-19 reopening plan for the Opera House. The Opera House is a huge building, and it's complicated, and it's got all sorts of rooms and crazy spaces. And so we obviously needed help in figuring out how to reopen this and keep it safe. So NSF developed a 278-page reopening plan for us. It's specific to every single space in the building. It's fantastic. It's detailed, and we refer to it all the time, even though we're not actually open to the public. We're rarely in the building. We do have security in the building. We have some facility maintenance people in the building, and occasionally we send, small groups of for example, some community program staff will go in and do some video recording or something for our digital programs. But over the summer, we labeled every single room with capacity limitations. We developed entry protocols and screening protocols. So whether we're letting thousands of people in the building or we're letting 10 people in the building, we have protocols and disinfection plans and everything in place. So over the summer, MOT also hired our new artistic director, Yuval Sharon, after a 4-year search for new artistic leadership following the retirement and then the passing of our founder, David DiChiara. So this was a really big thing for us. Our new artistic director, Yuval Sharon, is brilliant, and he led us to do something brilliant during the pandemic because unlike a lot of museums which are able to operate with limited capacity, the theaters have pretty much been shuttered, right? So even during the fall, there was a period of about a month or so in October and November when Theaters were allowed to reopen. What we learned was that our patrons told us very clearly they're not ready to re-enter theaters and sit side by side, even with capacity limitations in place. So we knew that was very clear. And there's an economic formula to operating theatrical spaces that just doesn't work when capacity is limited. You lose money on every performance if you can't fill your house. And theaters tend to be tight spaces, especially the old buildings like the Opera House, which is 100 years old. So it's incredibly hard to keep people safely distanced. You can block off seats and things like that, but just getting them to and from their seats, or how do you keep them safe, not just in the bathrooms, but getting to and from the bathrooms when your lobby spaces are small and tight. So, and lastly, opera and musical theater is all about singing, right? So it's not just the audience, it's the employees. It's nearly impossible to keep our artists safe from each other because singing involves, as Dr. Ruby Lee told us at the beginning of the presentation, forceful exhalations, right? So for all of these reasons, theaters are not operating right now, and we're not really able to open the Opera House. But as I said, our new artistic director, Yuval Sharon, brought us something brilliant in October. It was crazy, it was difficult, it happened during a pandemic, but it was brilliant, and that was Twilight God. So I'm just gonna really quickly tell you a little bit about that. MST owns a 7-story parking deck, and Yuval Sharon developed a drive-through opera in our parking deck. He used some of the greatest singers you can get anywhere in the world, singers who sing at the Met, singers who sing on Europe's greatest stages. He hired a diverse cast of performers to reflect diversity in our community. And he took a very famous German opera, Götterdämmerung, which is known in English as Twilight of the Gods. It tells a story of, from Norse mythology about the last battle fought between the old corrupt gods, and the battle destroys them and their corrupt old world order, and it replaces them with the dawning of a hopeful, new, brave, bright future world. So he took this famous piece of opera and he converted it to a 1-hour performance, translated it to English, and put one scene on every level of our parking center. He replaced the traditional famous horse that the hero rides in the final scene with a Ford Mustang, actually the 10 millionth Mustang that ever came off of the Ford line. And he used the scenery of this concrete parking structure to create an apocalyptic setting for this show. He engaged Detroit's own brilliant poet, Marcia Music, to be the narrator that ties the story together from scene to scene. And most of all, the patrons remained in their own cars with their windows up to keep them safe and isolated from each other while they experienced this performance. We engaged a sound designer who was able to use FM radio as the vehicle for the sound on each scene, and that worked really incredibly well. We designed parking formations around every scene at every level so that every audience member could have a clear view, and we hired parking teams to assist the patrons in getting their cars in the right formation around every scene. And we performed each scene on every level over and over. So each set of 8 cars moved from scene to scene to scene, and the next set of 8 cars came in behind them. Each set of performers performed each scene 12 to 14 times each night for 4 nights. Each scene was performed more than 50 times by the performers over the course of 4 performances. More than 400 vehicles drove through this and experienced the performance, 80 of whom were vehicles owned by City of Detroit residents. MOT saw patrons from 14 states come to these performances. 50% of our attendees were new patrons. We employed more than 200 people for the production. We raised more than $500,000 in sponsorships. We used 21 space heaters, 10,000 feet of cable, more than 400 LED candles, and 8 radio frequencies for this. And we generated incredible press. We had more than 40 press reviews and stories, including glowing reviews from the New York Times, the Wall Street Journal, the New Yorker, and lots of local media and industry press. So in putting this on, MOT provided COVID-19 training for more than 200 employees, volunteers, and contractors. We provided thousands of pieces of PPE. You wouldn't believe how many digital thermometers I bought just for those few weeks that we were doing this. We created online videos. We created QR codes to link our employees to the reopening plan that NSF developed so that everybody could have immediate reference. Every carload of patrons that came to us went through an orientation on how to stay safe, and they were asked to keep their windows up at all times. And in the end, no one associated with this production reported a COVID-19 infection. No employees, no patrons, nobody got sick. We were really fortunate to be able to do this outdoors and to do it in October when the cases were really low in Michigan. And it was a fantastic thing for our company and a fantastic thing for Detroit. Unfortunately now, all productions end and this production is over. We are going dark for the winter because you can't operate outside and you can't operate the theater right now. So everybody's staying home and staying safe. But we do hope to come back in the spring with more exciting and different sorts of productions like this.
Terrific. Thank you so much, Patricia. I'm going to pass it on to Mary Ann.
Paul, it is so totally unfair that I have to follow Patricia's presentation, because Twilight Gods was one of the most incredible productions that I have ever seen. So congratulations, Patricia. That was just a masterpiece. The only way that I can make a segue is to say that we at the Scarab Club are something completely different than any of the panelists. And first of all, I want to start out by thanking Midtown Detroit and NSF for working with us all summer to develop our playbook. We are a very small institution. I have 6 very part-time employees, and I just don't think we would have been able to manage it without the collaboration of NSF and Midtown, and all the advice that I got from my colleagues in the district. I'm the director of the Scarab Club. I'm also the operations manager, the facilities manager, you name it, I'm it. So it was a very steep learning curve for me, and I'm grateful to everybody who helped us along the way. And I'm particularly proud to have the checked by NSF designation on our front door. So thank you very much for that. As I mentioned, we're a very small institution. We are in a historic building, a building built in 1928. We're a members organization for artists and people who are interested in art. And we work with people, artists especially, in all media. So we present exhibitions. We have 12 to 15 exhibitions a year. We do lectures and performances and workshops for artists and all that sort of thing. And our goal, our mission really, is to bring people together. So we have a particular challenge when we have to keep people apart, which is what we had to start doing after the middle of March. So we immediately pivoted. All the staff, with the exception of one, works remotely almost all the time now. The only exception to that is our building manager, who comes in to service the boiler and run water through the pipes and do all that stuff, which he did all summer, which was really, really great. That helped us facilitate reopening a lot. We opened again in July when all of the cultural center organizations reopened, with a pathway through the building, with a mask mandate, with signage, with open doors to our gardens. So we have lots of ventilation as well as a renovated HVAC system. So we really were ready to reopen. But it's been a fairly steep learning curve for our members, most of whom are not used to coming into the Scarab Club and not hugging each other or the staff and wearing masks and going out the back door instead of going back out the front door. So that's been a learning curve, but fortunately one of my gallery assistants who keeps the building open also works for Starbucks. And so he understands what it means to make people follow the rules. And he's been really great at enforcing that. And I must say that our members and our staff have been really great about observing the protocols that we've put into place during this time. Like everybody, our social media became primary. And one of the ways that we are fighting pandemic fatigue is to put as much online as possible, even though even though it's been kind of a steep learning curve for us too, trying to figure out how to do that. We've done things like doing a virtual exhibition that parallels the exhibition that we have in the building so that people can see things online. And that has also increased our art sales because people can buy it from online. We also started a program called In the Studio, whereby artists take us on a virtual tour of their studio and talk about their work. That's on our website and also on social media. And people are able then to really get an idea of what an artist is like, because they are just as different as their work is. So those have been actually very fun things to do. But we've had to basically rethink everything. So even though we do fewer things than we did before, in some ways it feels much harder. It feels like we're working just as hard and like the proverbial Alice, running as fast as we can to stay in the same place. The good thing is that I think we are experimenting with programming in a way that we didn't before. We are well known and have been known throughout our entire history for our what are known as sketch sessions, where artists come and sketch from a live model, and anybody can do it. You don't have to call yourself an artist. You don't have to be a student. You don't even have to be a member. And so those, of course, stopped dead in March. And we've recently started them up again on a Zoom platform, which people seem to be pretty enthusiastic and pretty satisfied with, which is really great. And until the shutdown last week, we were figuring out how we could do small in-person groups with a model, but those now are at least on hold until after December 8th. But that's the kind of experimentation that we not only are forced to do, we want to do. And I think in the end, that's going to benefit us greatly, because we are an institution that is very tradition bound. And this is a good moment for us to break away from those traditions and do some different things, get our ideas out there, keep our members interested and engaged by changing things up constantly, which is a lot of work, but exciting and worth it in the end. And so far, all of our deterrents to COVID have paid off, and we have not heard about any outbreaks in the building, either from staff or members. So that's a great thing.
Mm-hmm. Thank you so much, Marianne. And okay, and if everyone could also mute their microphones, Marianne, and you are a very hard act for me to follow. So thank you. Amazing primers, folks. Clearly, the creativity is brilliant. The innovation is outstanding. Your commitment to your organizations, your stakeholders, your students, your employees, volunteers is also breathtaking. Excellent. Okay, let's cut to the chase. I've got some questions here. We talked. It seemed like there was a theme of communication and the importance of communication. I think it might have been Mike who may have alluded to some, maybe misinformation, miscommunication. I'm not sure what term you used. Let's talk about that, because miscommunication could really set back engagement and put you guys at risk. How do you stay ahead of miscommunication and misinformation?
I think through contact tracing really helped a lot, and to quickly possible to figure out who's involved with the exposure. If you have an exposure, how many people are involved to contain that and get them isolated, and then get that information out. Obviously, you can't put a lot of the information out publicly, but we use the website to track how many cases we had, and then we obviously get a hold of people that were involved and then get the area cleaned to where we needed to do it right away. But we had very few. I mean, of all the colleges, I'm really proud of the CCS community and everybody pulling together, because we were, 1%. And most of our cases were all commuters, which kind of makes sense, right? And the 540 students that are there on campus is very small. Any kind of cases. One thing I wanted to mention really quick is the Peacock Pledge, and that was for the CCS community. And basically, you would go on our website and it's posted. You'd say you commit to Peacock Pledge, and basically you take them. There's probably 20 steps in there. Say you have to, take the Michigan Symptom app when you come to. You have to show it to our security officers. You have to do that daily. If you're sick, you got to stay home. You got to wear PPE, and it goes down a whole list of things, including checking your email frequently. So that really got the commitment of the CCS community in, and what we expect and expectations are really important. So, anyways, thanks, Paul.
Okay, excellent. Thank you, Mike. And again, so there's misinformation around people who may be positive or not positive, but there's also some miscommunication in the public among mask usage, and some things that are a big deal or not a big deal, and and that could be very dangerous as well. So I'd like to hear from the others. How do you keep your employees informed when sometimes they're getting mixed messaging from home or elsewhere?
Well, for us at the Scarab Club, I mean, I had never used Zoom before until the middle of March, but we immediately started having Zoom meetings, Zoom staff meetings once a week. And which was a great thing because everybody's part-time, they don't see each other most of the time, but this was a way where we could all get together and talk. And at every Zoom meeting, even up until now, we talk about what to do, what not to do, how to deal with the public. It's a constant theme in almost every staff meeting that we have. So that reinforcement is, I think, the most critical for staff, because everybody knows what to do, but it's easy to get complacent. It's easy to let things slide a little bit, but with reinforcement, and now it's kind of become a habit too. And I think it's a lot easier now than it was, say, the 1st of April. To keep everybody engaged with what needs to be done in the building.
Excellent, thank you. Thank you. That term habit, it reminds me of John, who mentioned the term ritual. I wish we had an hour to talk here, but we don't, unfortunately. But next time I talk to you, John, I'm going to talk about the ritual concept. We have time for one more question, and I don't see any hands up, so I'm gonna get to ask it myself. Werner spoke about government toolboxes, so I'm going to ask you folks. What do you need from government? What can government provide to you at all levels of government to help you in your efforts to stay open and stay safe?
A second round of PPP loans would be really handy right now, Paul. But if you're asking me about non-financial measures,
whatever you need.
Okay, well then let's throw that PPP loan or some other relief program up there. That's hard to understate, and also disambiguation, some sort of common vocabulary lexicon for how we evaluate, how we respond, how we communicate to one another. I was talking to my dad who lives in New York. And I was getting my level 2 mixed up with his level orange, and by golly, if we're doing that, think of what happens when we multiply this by the millions of people who are affected.
Great, thank you, John. Anybody else?
I'll echo what John said. I think federal stimulus assistance is absolutely necessary. It's unbelievable. How it's really dangerous if we don't have this, because there's so many organizations that are hanging on the edge of a cliff by their fingernails. So that's number one. But from the state and local government, I would say I'm really appreciative of the clarity of the executive orders in Michigan. I think that and the new orders now, post Supreme Court ruling as well. I think in many states it's been much less clear, and with a lack of clarity, it's been very difficult for other organizations in other states to know exactly what to do, and they've kind of been operating blindly. Whereas in Michigan, we had clarity, we had direction. It was, you can do this, you must have a plan, you must train, and when somebody lays it out like that, it's really clear. This is what we have to do.
Thank you.
Yeah, that's absolutely true. Someone early on in the process said to me, read the executive orders every day because things were changing so fast. Yep. And that was the best advice I got the entire time.
Yep.
Yeah, and you literally have to read them yourself. Relying on someone else's interpretation or distillation is a recipe for just worse confusion.
John, I think it was you that told me that.
Well, it was me, and I think it was good advice.
It was great advice.
Excellent. So reading them every day became John's ritual. So there you go. Thought I could throw in that term. Folks, panelists, thank you again so much for your insight, taking the time to share it with the group here today. At this point, I'm going to pass it over to Anne Marie, who's going to introduce our next speaker, Dr. Robert Dunn. Anne Marie, it's all yours.
All right, thank you, Paul. Everyone, I'd like to introduce you to Robert Dunn, who is our Chief COVID-19 Medical Consultant for the City of Detroit. We're also pleased that he has ties to two of our cultural center institutions, both Wayne State University and the University of Michigan. He is an emergency room doctor, and I have to also say he has been so kind with his time with Midtown Detroit Inc. and with NSF, providing support throughout this entire process of trying to guide us in the right way on the reopening plan for the City of Detroit. Dr. Dunn, take it away.
All right, well, thanks. I know we've had a long morning with everybody so far, but to me, this has been absolutely great. Many of the people here have been great partners for the city. MIOSHA has been essential in helping us, NSF. As everyone knows, we dove into this in Detroit, unfortunately, very early. Detroit had the highest case numbers and highest number of deaths per 100,000 population of any city in the first wave. And that really stressed us, stressed our resources. And we already had a pretty good team. I'd say one of the things that was a little frustrating about the pandemic as a whole, as someone who's been involved in preparedness since the 90s, we've been talking pandemics and drilling pandemics since the 2004 SARS outbreak. And a lot of those plans turned out to be just pieces of paper, unfortunately, from a lot of different systems. So we had to build a team that used some of our regular relationships. I'm very involved in public safety. My kind of traditional job in the city has been the public safety medical director, working with first responders. And I would work with the health department on research and social determinants of health and things like that. We'd certainly done a number of public health response projects in the past. Many of you remember the hepatitis A outbreak. So we were very involved in data gathering and vaccination for that. But we really spun up a great team fast, including public safety, the Detroit Health Department, especially environmental health, who was just terrific for us. And we worked with the health systems and the university. Many people remember that one of the first challenges we had here was we really needed some testing. The city spun up their own testing because that was the only way we were going to get it. Initially, with partnering with Wayne State and a number of other labs and setting up the state fairgrounds with some of the health systems, and then working with Abbott. We were the first site in the country that was using the Abbott ID Now product. Literally, we sent someone in vans to Chicago to drive the stuff back so we could start using it because we needed it for patient care. We needed it for employees. As we moved through that, we also quickly realized that not just our first responders, but there are so many essential services. So we had to kind of figure out a way to keep some things open or to open back up some things very early in the pandemic when there was very little guidance or conflicting guidance. Everyone kind of remembers that. And we reached out to a lot of partners to help with that. And we kind of just treated everybody, regardless of what job they had, as a healthcare worker and kind of followed the healthcare worker guidance for that. As things moved ahead and we got guidance from MIOSHA and other leaders, we moved to more refined plans. But still, I think everybody today pointed out to some of the key things for reopening. One, don't get people in the workplace if they don't need to be there. If you can do anything to keep people out of a crowded situation, absolutely essential. Particularly our IT was great at getting resources to people, improving VPN access, doing things to keep people out. And that is still a core part of what we're doing in the city of Detroit, is making sure that anyone that needs to be, that has to do something in a city building, or even contractors working for the city, are absolutely have to be there. And once they're there, we're doing, I think, what everyone else is doing in terms of screening, a couple things I just want to point out that I think have been very positive for us and our employees is we've had an excellent team of people, particularly using our human resources for tracking our folks that are in quarantine and isolation, regardless of how they got exposed or how they got sick. They're getting a call every day from an HR rep, making sure they're okay. We can help facilitate medical care. We've literally sent, a community paramedic to people's homes at times to check on them. And I think that, especially during the scariest times, was something that was really reassuring for all the city employees. And that was something that I count as a great win. The other thing, we still have a big enough medical team that we're able to look at every single exposure and every single positive case individually. We jumpstart contact tracing, just like the gentleman was talking about at CCS. We're starting that in-house, working with the health department. As people know, our employees come from all over the metro area, so their health department of record, where they live, is doing some contact tracing. But as an employer, we really feel that's important as well to kind of start that immediately. We have the ability to do that 7 days a week. When we were very busy, we had a team of emergency medical services, paramedic supervisors that actually would get out, do some interviews, get the information that the health departments need, but also help to reassure our employees that we're focused on that. Someone talked about misinformation and just lack of information, and I still think that's a challenge. We still get a lot of questions about people like, I drove through a town where there was a lot of COVID. What do I have to do? And there are some literally very very nervous folks that we're trying to work with and trying to stay focused on, and learning from all the new science that's out there. That is the other kind of ongoing challenge, is to keep reevaluating everything that we're doing. And I think that keeping up is probably one of the hardest things. Someone mentioned making sure you read every word in the executive orders. I cannot emphasize that enough. It sounds boring, but it's a really important thing to do to help understand it yourself. And if you're not sure what they say, reach out, ask questions, try and find out, whether it's working with local authorities. Our health department director, Denise Fair, our chief health officer, has been absolutely vital to help people interpret the orders. And she's got Dr. Khaldun, who was our former director, on speed dial. So if you need interpretation from the state, the health department can help with that as well. So I know we've had kind of a long day, and there were just a couple other things I wanted to mention. That the city has been fairly innovative at helping businesses with things like street closures, expanding restaurants and things like that. And that has also taken a group from the health department, public safety, fire inspectors to make that happen. And I really, I'd worked part-time for the city for a number of years, again, just focusing on first responders. Pretty happy with what the administration had done. But as someone who got extremely involved in this, I was impressed by how fast things could go. I think anyone who's worked the city of Detroit sometimes thinks that things can take a very long time to happen, but the nimbleness that the city was able to show in this definitely impressed me as someone who'd kind of been involved as an insider. And there's more of that going on right now. I mean, Detroit is clearly working with local businesses to try and find the best ways to help them, and also getting ready for the rollout of the vaccine. People asked some questions about that, and I know Sean mentioned some things, and I think he's absolutely right. It's going to take quite a while before we have large amounts really available for the general public, but vulnerable populations and healthcare workers and other responders are kind of getting targeted in that first wave. And many of you who helped with things like using your parking lot for something, what is something that may well be needed for the vaccination program. We did, for those of you who remember, the last pandemic, which was nothing quite like this, a lot smaller scale, 2009, 2010, we were doing drive-through vaccination with the City of Detroit Health Department, County Health Department, for a lot of people during the H1N1 pandemic, and we're reusing those plans today, but scaling them up. So I think as we move forward, yes, there is some light, but I think everyone's very concerned now that the cases are going up steadily. I think everyone showed some of that today, and that it's stressing our health systems across the state more than it's stressing our health systems in the city proper right now. But remember, those are all part of larger systems. So, you know, anything anyone can do for yourself, for your employees to stay healthy is going to benefit everybody. And I think that that's something I just want to end on, a message I give every day to our employees and the first responders I work with.
Are there any questions for Dr. Dunn? Okay, I'm not seeing anything. It's kind of quiet out there. Paul, any final thoughts from you?
I love how Dr. Dunn ended by saying anything you can do to help yourself or to help your employees, your customers stay healthy, stay safe, helps everyone. I think that we tend to forget the ripple effect, right? One person, a 20-year-old getting, contracting COVID-19 might not be a big deal, but the ripple effect can be so significant. So thank you, Robert Dunn, for mentioning that. That was an important point.
Okay, well, if we don't have any further questions, we have actually made it on time to 12 o'clock. We will, if anyone would like to send us follow-up questions, if you think of something after the symposium of any of our panelists or even Dr. Dunn, we're happy to forward it on. We will share out the presentations that were given today. We will also be posting videos of each session, and we'll share the links for that with you. What I've learned the most is that we have to take care of each other and also continue to share information amongst all the institutions as we move forward. Our work with NSF is kind of coming to a close with their contract for the cultural center institutions. However, there are opportunities for every institution to expand on that moving forward, or to just keep continuing sharing information about what's working for each institution. So I hope that you all remain safe and have a fantastic Thanksgiving.
Bye, everybody. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Good night, John Boy.